Let's be honest. Cancer isn't always loud. Sometimes it whispers. Especially in older adults, the signs can sneak in under the radar, hiding behind things we've learned to chalk up to just getting older. But here's the thing. Not everything should be dismissed as normal aging. That lingering fatigue, sudden weight change, or even a persistent cough might be trying to tell you something. And while no one wants to jump to conclusions, it pays, literally and emotionally, to catch these signs early. So, let's talk about those unusual, easily overlooked symptoms that could be early red flags for cancer in seniors. 1. Unexplained weight loss, not just getting slimmer. Sure, shedding a few pounds without trying might feel like a blessing. But in older adults, it could be a sign of something serious. Cancer often feeds off the body's energy stores, leading to sudden, unexplained weight loss. If you or a loved one drops 10 pounds or more in a few months without changing diet or exercise habits, it's worth checking in with a doctor, especially if it's accompanied by fatigue or changes in appetite. 2. Chronic fatigue that doesn't improve with rest. We all slow down a little as we age. But when you're dragging your feet, no matter how much you sleep, that's not just age. That's your body waving a red flag. Certain cancers, like leukemia or colon cancer, can cause persistent tiredness due to internal bleeding, poor nutrient absorption, or overall inflammation. If you feel like you're running on empty, even after a full night's sleep, don't just grab another cup of coffee. Talk to your doctor. 3. Subtle skin changes, more than just age spots. You know your own skin, so when something starts looking or feeling different, a mole changing shape, a sore that doesn't heal, or odd discoloration, pay attention. Skin cancer, including melanoma, often starts out looking innocent. The ABCDE rule can help. Asymmetry, border irregularity, color variation, diameter over 6 millimeters, and evolving features. 4. Persistent cough or hoarseness that lingers. Let me guess, you've blamed it on allergies, a dry throat, or maybe even that old habit of sipping something too cold. But if a cough hangs around longer than 3 weeks or keeps getting worse, it's time to investigate. This could point to lung cancer or cancers affecting the throat or esophagus, especially if it's accompanied by chest pain, shortness of breath, or blood in phlegm. 5. Digestive changes. When the gut gets weird constipation, diarrhea, bloating, or feeling full too quickly. We often laugh these off as part of getting older or having a sensitive stomach. But gastrointestinal cancers, including colon and pancreatic cancers, often start with subtle digestive issues. If these symptoms persist, especially if they're new or worsening, don't just stock up on antacids. 6. Unusual bleeding, a red flag. You shouldn't ignore blood showing up where it shouldn't. It's not something to wait and see about. Whether it's blood in the urine, stool, or from coughing, unusual bleeding is one of the most direct warning signs your body can give. In older adults, this could be linked to bladder, kidney, colon, or lung cancer. 7. Changes in bathroom habits, a quiet shift that speaks volumes. Needing to pee more often, having trouble peeing at all, or feeling like you can't fully empty your bladder could be more than just aging. For men, prostate cancer is a usual suspect. For women, bladder cancer is often underdiagnosed because the symptoms can mimic a urinary tract infection. So if it doesn't go away with antibiotics, push for more testing. 8. Difficulty swallowing, not just a sore throat. If swallowing suddenly becomes hard or painful, it could be a sign of esophageal cancer. This can creep up slowly, starting with occasional discomfort and turning into consistent trouble eating or drinking. If you're reaching for soft foods more often or skipping meals because it just doesn't feel good going down, take note. 9. New or worsening pain, a body's cry for help. Aches and pains come with age, yes? But new Unexplained or worsening pain can be a sign of cancer pressing on nerves, bones, or organs. Bone cancer, brain tumors, or even metastases, when cancer spreads, can cause pain that doesn't respond to typical treatments. Trust your gut. If something feels off, it probably is. 10. Changes in the mouth, not just dentures acting up. White patches, ulcers, or bleeding in the mouth that won't heal should never be ignored. Especially for those who smoke or drink alcohol, oral cancers are more common. It's not just about brushing and flossing. Regular dental checkups and being aware of oral changes can be life-saving. 11th. Swelling or lumps that weren't there before. Not all lumps are cancer, but some are. Whether it's a lump under the arm, in the neck, or somewhere less visible, get it checked. Swollen lymph nodes, unexplained masses, or anything that seems to grow or change shape deserve medical attention. Your doctor can do a quick exam or order imaging if needed. Final thoughts. Cancer in older adults often wears a disguise. It doesn't always shout. Sometimes it whispers. And because seniors often already deal with aches, fatigue, or appetite changes, it's easy to miss what's abnormal. But here's what you should remember. Knowing your body is key. If something doesn't feel right, say something. If a loved one seems a little different, don't hesitate to bring it up. Early detection saves lives. And while no article can replace a doctor's judgment, being informed can give you a head start. You don't need to panic, just pay attention. That quiet little symptom could be more than it seems. And catching it early? That could make all the difference. Stay curious, stay calm, and most importantly, stay aware.